So, dear future nurses, I'm discussing on the introduction of ethics, the foundational ethical concepts, and some historical perspective in the ethics of nursing now, of ethics in nursing later on. Okay, now, if you can notice, during our orientation, I am using several references. Most of it is coming from Kiambao Udan, Healthcare Ethics, which is published 2023. Then I'm also using the book of Timbresa, Isto Esta, and Juan. Okay, these are substantial textbooks which focus in nursing ethics. So I hope that you will be able to look into these references if you would want to read further about the topics that we are talking about. So guys, basically, we study ethics because one of the things that is constant, obviously, is change. Okay? What may be true today may not already be true tomorrow. And what may be an effective treatment today may already be a different treatment in the years to come or by the time that you will graduate. Okay? There may be already changes on the way that diseases will be managed by the time that you will graduate. There may be changes also on drugs or the way drugs are administered or what drugs will be administered to your patients. That's why we need to understand ethics. And right now, a very common thing that is being done in the clinical setting is research. Now, we have the conduct of research in various settings. So, especially in the clinical setting when you are going towards your duty. So, when you talk about research, you talk about research as an opportunity for us to study, an opportunity for us to understand an existing phenomenon or problem. But with research, you need to understand that you are also placing your client at risk for exploitation. You are placing your client at risk for exploitation. What do I mean by that? For example, if a research will be conducted on a certain medication, if a research will be conducted on a certain drug, the tendency is that your patient will be aligned or inclined, inclined to go on with this research. Imagine you have a patient with cancer, and then here comes a research which can possibly offer a cure to cancer. So the tendency is that your client will be entering to this research because they would want also a cure for cancer. But as researchers, or I mean as nurses, your role is, okay, the role of the nurse in research is to stand as the patient's advocate. Okay, you need to stand as the patient's advocate. In other words, guys, will you allow the researcher to force your patient to participate in research? Will you allow the researcher to force your patient to participate in research? Anybody?
No, sir.
No, sir.
Okay?
No, sir.
So class, kahit sabihin pa class na may bayad, kahit sabihin pa class that this is an opportunity for cancer to be cured, if your patient does not want to participate, do not trigger, do not force your patient to participate. Okay? Because your goal there is that you should be a patient's advocate. Now, for example, here comes a researcher which will go to the hospital. Okay? Isipin nyo class kayo yung nurse kung saan yung patient naka-admit. Tapos may researcher, pumasok siya sa room ng pasyente. Sabi ng researcher, "Sir, sign mo tong consent." Okay, the researcher gave a piece of paper to your patient and then said, "Sir, sign this consent." Will you allow that to happen or is there something else that needs to be done? Sige na, somebody came in.
There's
Sabi niya,
something else, sir, na
okay,
needs to be done.
So there's something that needs to be done. And who can tell me what needs to be done? Okay? Prior sabihin na, oy, pirma ka na para mag-participate ka. Ano pang dapat gawin, class? Anybody?
Sir, first,
Yes, go ahead. Jerome, was that Jerome? Did I capture it right?
for me, sir, sa ako no, Bron, sir, dapat i-orienta to ng pasyente if ano ba lang ilang nga sudlan. And then, it would be up to them na ma-participate, sir, considering the fact na gihatagan na sila sa waiver, sir.
Okay, that's correct. Okay, that's correct. Anytime, class, that your patient would sign that form that we refer to as informed consent, the patient, class, as the term implies, the patient should be informed if what is happening to, what is about to happen. What are the things that will occur in this study? What will happen if he will participate? What will happen if he will not participate? Because as the term implies, informed. In other words, kung sa Ilonggo pa class, dapat kabalo sila kung ano ang ginasunod nila. Dapat alam nila kung ano yung pinapasok nila before they get to decide. So nobody can tell your patient, sir, you have to sign this. And nobody can tell your patient na, sir, if you will not sign this, hindi ka na namin iti-take care sa hospital na to. Okay? Because at the end of the day, it is your patient's right to refuse. It is your patient's right to refuse. And as my main point for this discussion, guys, there's a lot of things that are changing in the clinical setting, in the patient care setting. And with this change, we should be all anchored to ethics. Okay? Halimbawa, pag nagdadalawang isip ka, anong uunahin ko? Just ask yourself, what is ethical? Whatever is ethical, that takes precedence. Right? A very good example that I can observe in the clinical setting is this. Napakaraming paperworks recently. Okay? Especially with the pandemic, there are a lot of paperworks that needs to be accomplished. There's a lot of documentation that needs to be accomplished. Now, here comes the call bell. Familiar kayo ng call bell, guys? Yung pinipress sa hospital, tapos magre-ring-ring, kaya magre-ring sa station, tapos tatakbo si nurse. Class, if you get to choose, what will you prioritize? Is it the call bell ringing? Is it the computer documentation? Or letter C, is it the written documentation in the patient's chart? Assuming na lahat sila class mangyayari at the same time, ano dapat ang unahin natin i-prioritize?
Ang call bell, sir.
Call.
Mhm.
Call
Sige.
Ang bell.
For those na hindi sumasagot, yes, you can use the chat. Yes, maraming nagsasabing call bell. Ay, sorry, nasaan na yun? Okay, how about others? What's your point of view? Agree ba kayo, guys? Written documentation. Yes. How about others? Sige. So class, no? What I'm depicting to you here is a common situation in the hospital setting. Okay, what I'm depicting to you here is a common situation in the hospital setting. We cannot deny na napakaraming written works na dapat gawin ng nurses. Napakaraming documentation na dapat ginagawa ng nurses. Anong problema ngayon, class? Yung nurses, inuuna na yung mga documents, nakakalimutan na yung patient. So guys, since we're learning ethics, since we're learning prioritization of care, over documentation, guys, you would prioritize your patient. Okay? Don't think of it just as a call bell. Huwag niyong isipin na call bell lang siya. That call bell is an indication that your patient is actually needing help. Okay? But later on, you will be able to see in the hospital, hala, kadamo-damos ang ginaobra sa computer. Hala, kadamos ang dapat isulat sa chart. Kung nagaringga niyang call bell, daw wala na nakabati. Okay? So this is an example of the changing times, the changing standards, and then the changing demands in the healthcare profession. Okay? Hindi takamuklas, I could not tell you that nursing course or nursing work is easy, because it will be challenging, because there are things like this that you will encounter. Imagine that you are in front of the doctor, you need to carry out a doctor's order, and then the call bell is ringing. So ethics would tell you, prioritize your patients. And I hope that you will be able to practice that when you are working on in the future. Then second is the technological development. So plus technological development, anong very good example yan. If you have listened to the previous discussions, you would notice that I've mentioned about cloning. Okay, I've mentioned about cloning. I've mentioned about transplant. I've mentioned about genetics. Okay, this all entails ethical problems. So halimbawa, cloning is still not ethically acceptable. However, our technology is already capable of cloning. As in clone, na pwedeng gumawa ng replicate natin. However, ethical standards would not yet allow it. Transplant. Okay, transplant, no? And the ethical question there comes, who will first? Who will be able to receive the organ that is donated to a certain patient. Okay, so that is where the issues in transplant would come in. And then, other than that, dear students, okay, other issues that would come into picture is you have your, may tinatawag pa tayong mga advanced machines, guys. You already have your example is your ECMO. Okay, I think I've mentioned this. You have your ECMO, your extracorporeal membrane oxygenation. Okay, extracorporeal membrane oxygenation. So class, anong talent or anong ability ng ECMO machine? The ECMO machine could act as the temporary heart of your temporary lungs of your patient. Okay, the ECMO machine could act as a temporary lungs of your patient. Eh sir, ano ngayon kung temporary lungs siya? It raises the question of when can a patient be considered clinically dead? Okay, it raises the question of when can the patient be considered to be clinically dead? Okay, and it also raises the question who will stop the life support if ever that the patient is on the vegetative state already. Okay, or ang tinatawag ba natin in Ilonggo that you refer to as vegetable? I don't know if you've heard of that expression na ay, kabuhay na sa iya sa ospital, vegetable na siya pagwaya. I don't know if you've heard of expressions like that, okay, which pertain to maybe severely stroke patients wherein their prognosis is very poor. Okay, inabalaklas ng mga pasyente nga kay do hindi nakahulag, do hindi naman kaginhawa, kay kumbaga do lantang vegetable nga ara sa bed, no? So we commonly use the term vegetable. So yeah, in medicine, we have the term PVS. We have the term persistent vegetative state. Okay, persistent vegetative state. So in other words, yung pasyente hindi talaga gumagalaw. The patient has been comatose for several days or weeks already. Okay, so technological advancement gives us the question: when is someone really clinically dead, or when is someone dead already? Okay, or will you pull out the life support? Will it mean killing somebody if you will pull out the life support? So those questions arise. And because of those questions, we have remedies class that we refer to as healthcare proxy. And then another remedy is that you have your advanced directives. Okay, so you have class remedies such as your healthcare proxy and then your advanced directives. Pag sinabi ko, dear students, future nurses na healthcare proxy, it is appointing a substitute. Okay, appointing a substitute decision maker. Okay, so class healthcare proxy is appointing a substitute decision maker. So, for example, in my case, I could say that I, Albert John Porque of legal age, do hereby appoint blank to be my healthcare proxy. That person whom I appointed as a healthcare proxy, okay, we are not asking for it, but for example, if the time comes that I will become comatose and I am unable to decide for myself, it will be my healthcare proxy who will make the decision for myself. Okay, it will be my healthcare proxy who will make the decision for myself. Whereas when I talk about advanced directives, your advanced directives class is a document. Okay, it's a legal document that details your plans in case of inability to decide. Okay, if you're writing notes, just write legal documents decision. What do I mean by that? I can write in the piece of paper something like, if ever I will be in comatose, I do not want to be placed in advanced life support. I do not want to do CPR in case I will be in comatose. I would just want to rest peacefully until my last breath. Okay, you can indicate something like that in your advanced directives in such a way that if that day will come wherein you are not feeling well, wherein you are unable to decide for yourself, your family and loved ones will not be torn already on how to make the decision. Okay, yan po yung tinatawag natin na advanced directives. Okay, so quick recap guys. When I talk about appointment of a person to act as a substitute in your behalf, what do you call that?
Healthcare proxy.
Okay, so you have your healthcare proxy. And if I talk about the document wherein you will indicate your wishes, wherein you will indicate the decisions that you would want at the end of life. You refer to that as
Advanced
Advanced
directives.
advanced directives. Okay. For this next question, I was not able to talk about this, but let's just try if ever you know. What do you call naman a document that details how an individual will be distributing his property, his house, land, money? What do you call that document?
Last
Will, sir.
will,
Okay,
sir.
that's your last will and testament. Okay, or simply your will. Okay, or simply your will. Okay, so what I'm trying to drive is that with the different concerns that arise with the technological advancement, we also have remedies. Okay? And among those remedies is what I mentioned. So you have your healthcare proxy, your advanced directives, and then you also have your will for that matter. Now, class, let's say for example, wala kang advanced directives, wala kang healthcare proxy, wala kang will. Who will decide if ever an adult gets to be admitted in the hospital and unable to decide for himself? Sino po yung magdidesisyon?
Family members, yes, sir.
Family
Parents.
members. Okay, family members.
Family members.
Let's say for example, kasi Pinoy tayo, di ba? Family members. Pagka-hospital ng isang pasyente, isang jeep ng family members dumating. Isang jeep ng family members arrive at the hospital. Who would get to decide? Is it the wife, the mother, the sister, the grandmother, the grandfather, the son, or the daughter?
Wife, sir.
The wife, sir.
Okay. Now, it comes to a point na marami siyang wife, no? Marami siyang wife. May dumating sa ospital, sabi ako ang wife. Tapos yung second dumating, sabi I'm the legal wife. Tapos may pangatlo pang dumating, ako yung ka-live-in partner among the three class who will take precedence when it comes to the decision.
The legal wife.
Legal wife, sir.
Legal wife.
Okay?
The legal wife.
It's the legal, okay? It's the legal wife. Okay? Why am I giving that? Now, some of you are smiling. Okay? And you might be wondering, sir, parang joke naman na example yan. It already happened in the clinical setting class. No? I've already witnessed something like that, wherein somebody was making the decision, and then a day later on, somebody presented and identified herself to be the legal wife. Okay? So class, pag may kaharap kayo, dapat magtanong, okay? Mami, I know your complete name. Huwag nyo namang tanongin, Ma'am, ikaw ba yung legal wife? Don't sound to be as offensive like that. Ha? Huwag mong sabihin, Ma'am, ikaw ba yung legal? Okay? So wag tayong ganun magtanong. Ma'am, can I please ask you of your complete name? Pagkatapos, if you know that the last name of the woman is not that of the man, you ask further questions. Okay? You ask further questions. But don't right away conclude, ha? Question, by the family code of the Philippines, is it okay for the woman not to carry the last name of the man? Okay lang ba?
Yes, sir.
Yes, sir.
Okay?
Yes,
So pwede.
yes, sir.
Pwede, no? For example, Frian. If Frian would get married, she can still use Subong. If Ira could get married, she could still use Akolea. Okay? As long as they both agreed to that. So wag ka munang mag-conclude, ay, may the name yung gamit niya. Baka hindi sila married. Okay? Wag judger. Ha? Okay? Slight lang. Okay? Kaya magtanong to verify. Okay? But please don't jump into conclusions. Okay? So that's on the side. So basically, class, there's a lot of reason why we are studying ethics. And I'm giving you scenarios like that for you to understand that they occur in the clinical setting. And other than that, there are organizational problems that also arise in the organizational environment. One is low staffing that would also lead to overload. And then you have your hierarchical interactions. Okay? Low staffing class, what do you think? How many patients are nurses capable of handling? Ilang patients kaya yung limit natin, class? Anybody?
Based on the video, sir, 1:6, sir. One
Okay,
patient
1:6.
to I. Correct.
Okay. Others? Yes. Others.
If severe na sir, like sa ICU, you said sa video, it should be 1:1.
Okay. Very good. Very good insights. No? So class, the minimum standards per the Department of Health okay, per the Department of Health, that's our regulatory body, is that one nurse should be handling 10 to 12 patients in the public hospital. This is more common in the public hospital setting because it's the minimum standards. But as I have mentioned, one nurse could take care of 6 patients. This is the ideal, and this is commonly practiced in private hospitals. And you were correct to recall that in the ICU or in the intensive care setting, you need to have one nurse is to 1 to 2 patients. Okay, one nurse will take care of 1 to 2 patients in the critical care setting. Okay, that's how it works. No? That's how it works when it comes to the number of patients handled. Pero you know what? With the present situation right now that we have, the real situation is that there are instances that one nurse would handle 15 patients. During the time of the COVID, there were instances that one nurse is handling 20 patients. Okay? Paano naging ganon? No? Okay? So, maybe I will change muna my question. So, do you want to shift na? Baka gusto niyo nang mag-change ng course? It's not too late. Anyway, kidding aside, so bakit nagkaganon, class? Because of the low staffing. And during the time, class, of the pandemic, there were nurses also who were victims of COVID-19. Okay? May mga nurses din na nabibiktima ng COVID-19. Yung COVID-19, guys, hindi lang naman exclusive. Hindi lang naman exclusive sa mga patients natin. May mga nurses din na nagkaka-COVID-19. And if these nurses had COVID-19, there's nobody to cover for them. Okay, so that's why, class, there is really a shortage of nurses. If I would look at this from your perspective, it may be discouraging to sound, but you know what? This simply indicates that by the time you graduate, there's a job waiting for you. Okay, by the time that you graduate, there's a job waiting for you. So I hope that you will be able to be employed right away. Low staffing is a real picture here, especially in the Philippine setting. And you know what? Even abroad, especially during the time of the pandemic. Okay? So, overload. Bakit tayo na-overload? Kasi lahat ng gawain plus trabaho ng nurses in the hospital. What do I mean by that? Pag walang gamot yung pasyente, problema ng nurse. Pag walang magkain yung pasyente, concern ng nurses yon. Pag hindi gumagana ang aircon ng pasyente, concern ng nurses yon. Pag sira, for example, ang floor ng patient, concern din ng nurses yon. Pag hindi pa na x-ray yung pasyente, concern din ng nurses yon. And other than that, there are a lot of demands right now in the healthcare industry. Our clients are actually becoming more legally conscious. Okay? May legal consciousness na among our patients. And they would know when a nurse would become negligent or malpractice. No? So alam nila kung kailan may negligence at kailan may malpractice. So that's why we also need to be very careful. Okay? I am not discouraging you, but I am just telling you the real picture that is happening. For you to be able to prepare by the time that you will graduate and you will be able to work as professional nurses. Okay? That's not a discouragement, but that is the real picture that is happening right now. And then plus you have hierarchical interactions. Okay? You have the term hierarchical interactions. Who can explain to me what is hierarchical interactions? Who can
Sure,
tell
can
me?
I, sir?
Yes, go ahead. Sige, go ahead, Jerome. Wala, hindi ko siya marinig.
Try lang, sir.
Okay, Gian, yes, go ahead.
From the word hierarchy, sir, maybe biskan hindi taman maukas any place kung din kita go work. Mera gid na bala, sir, the older or the more experienced our peers are, mera gid na aga look down sila sa aton sa amon nga mga novice nurses and those nga mga bag-o pa lang sa field. So muna sir akong pag-understand, sir, sa last number 2.
Yes, you are actually on point, no? You are actually on point. And that is one problem that is arising in our current health situation also. Oftentimes we say, okay, our advocacy against it is that don't eat our youngs. Okay, don't eat our youngs. Tama yung example na binigay mo, wherein the senior nurses, okay, like us, for example, would see the novice nurses as Uy, katamad. Uy, hindi ka man kabalo ka obra mo. Uy, nga hindi ka na iya kabalo nga wala kaya gapanilag kung anong obrahon mo. Okay, there are a lot of comments like that. No? And true to that, that is hierarchical. Okay? Yes, Princess, you're about to add something?
I think sir ang sa base wala sir sa video nga ging post mo sir, I think that ang hierarchical interaction is also about communicating or ang collaboration wala sir nga nagatake place sa healthcare facility. Kaya ang mga nurses, di ba sir, nag-interact sila hierarchy nga ga-include sang mga different levels man of authority, such as we have nurse assistants, may are ang registered nurse, mga nurse managers, and mga doctors, sir. Kag though all about gid siya sir sa clear communication, kag respect for each other's roles, kag approach sa patient care.
Okay, thank you very much for the wonderful insight. And again, class, it's correct. No? There's a lot kasi of levels that we need to deal with. And that's what I'm trying to depict with the boxes here that I'm trying to draw. So class, basically, no, kung ikaw itong staff nurse, guys, okay, above you, you have your head nurse. And above your head nurse, you have your nurse supervisor. Above your nurse supervisor, there's still a chief nurse. Above the chief nurse, there may be a medical director. And above the medical director, there may be an overall hospital administrator. So, look at it. Pag may concern ka na nurse, marami ka pang dadaanan. Okay? Hindi pwede class na didiretso ka eh. As a nurse, I could not talk directly to my medical director. Okay? That is not allowed. That is not encouraged for me to go directly to my medical director. As a nurse, dapat mag-refer muna ako kay head nurse. Tapos si head nurse kakausapin sa supervisor. Pag hindi kaya class, kakausapin si chief nurse. And I hope you get the picture. Ganon katagal for your concerns to reach the administration. And okay, I think Princess has also mentioned that you need to collaborate with several people in the field. Ikaw yung nurse, kausap mo yung respiratory therapist, kausap mo yung medtech, kausap mo si doc, kausap mo si lahat ng healthcare professionals. And although we encourage collaboration, in this aspect that we are discussing right now, we are discussing the disadvantage of hierarchical interactions. Okay? Minsan kasi class, tulad ng punto ng unang classmate na nag-share, okay? Hindi natin class maiiwasan na sinasabi nila na, uy, senior ako, follow what I say. Okay? Or, hey, I'm the boss here. You don't need to ask questions. Okay? Just do what I'm saying. And that is where frustrations would come in. Okay? And plus, I have heard also of stories, no? For example, of sexual abuse and sexual advances. Okay? Pag sinabi natin plus sexual abuse, it does not necessarily mean na may sexual contact. Okay? It does not necessarily mean na may sexual contact. Possible naman kasi class, no? Possible naman kasi, for example, in the clinical setting, okay, somebody touch your private parts. Okay? That could already count as sexual abuse. No? For example, if you're doing surgery, ikaw yung nurse. Kasi class, if you're doing surgery, you need to remain sterile. Your hands should be on the table or just above the table so that you will remain sterile. Okay? Later on, you will know that in the concepts of OR. But for example, if somebody will touch your private part, somebody will touch your butt, oftentimes, class, nalalagay pala tayo sa situation na, hala, young pa kasi ako. Parang wala akong right na mag-complain. Are you getting what I mean? Diba? So oftentimes, no, okay, that happens pala even in the workplace, no. So now since we have touched on the topic, if ever class, no, knocking on the wood, but if ever that will happen to you, what do you think will you do? Will you tolerate it or will you have zero tolerance on it?
Zero, sir.
Okay? So class, zero tolerance. And boys and girls, this could happen to you. Okay? Hindi lang to class na sa babae lang mangyayari, no? We need to be aware that both boys and girls, okay, ladies and gentlemen, this could all happen to you. And class, when I say zero tolerance, you should mean it as zero tolerance. Bakit? If you will allow it the first time, for example, hinipo ka, okay, your butt was touched, your ass was touched, for example, for that matter, as an example, okay? Tapos kas pinabayaan mo lang, sabi mo, junior nurse kasi ako, hindi mo na ako magrereklamo. what will happen? The next time class, uulitin yan. Okay? And then the next time, sasabihin, uy, itong nurse na to, hindi naman to nagre-reklamo eh. Okay? Even if you will touch her, hindi naman siya nagre-reklamo. So let it be. Okay? Hayaan mo siya. Okay? Let's keep on doing it. Okay? So that's why class, zero tolerance. So what do I mean naman by zero tolerance? By the time that will happen to you, class, you can right away face him or her and then tell him that I don't want that to happen again. Okay? I noticed that you touch me. I don't want that to happen again. Dapat clear kayo, class, sa boundaries ninyo. Are we clear with that? Are you getting my message on that? Okay. Now, how about, sir, if hindi pa rin siya naniniwala sa akin? What will you do? Will you inform the head nurse or will you post in the social media?
Inform the head nurse.
Inform the head
Inform the
nurse,
head
sir,
nurse.
the head nurse.
Inform the next
Nurse. Inform the head nurse. Okay? Bakit yung option B ko, post in the social media? Kasi class, no, in our current generation, mahilig tayong mag-share sa social media. And students, mind you, when we talk about legal concerns, when we talk about ethical concerns, it's unethical for you to deal with it in the social media. Okay? Class, pag nag-post ka sa social media, halimbawa sabihin mo, Dr. A, sexual abuser. Class, at the end of the day, baka ikaw pa yung makasuhan kasi siniraan mo siya in the public. Are you getting my point? So do not post in the social media your ethical and legal concerns, okay? Or else it might go back to you. No? So that's one thing. No? So hierarchical interactions in leadership and management, we also refer to this as bureaucracy. Okay, we also refer to this as bureaucracy. Okay, so parang naiipit ka, when is the best time for me to talk to the medical director if this is my concern? Okay, things like that. Okay, Racine has inserted the word defamation. Tama, na? So I think it's on the example that I've mentioned on the social media. So pwede ka class makasuhan ng oral defamation or pwede ka ding makasuhan ng cyber libel. Okay, may tinatawag tayong cyber libel. Okay, so those are what's happening in the organization wherein your ethics would have a very big impact. Now, guys, in terms of concerns, there are two different levels of concerns. Now, there are two different levels of concern. Class, anong tawag ko sa level ng concern na may poor communication, may bullying, may incompetent colleagues, tapos may practice error at saka collegial collaboration? Anong tawag yan? Sige na. What level of concern is that? Anybody?
Excuse me, sir. Pwede, sir, pa-repeat some question, sir. Kaya nag-auto-tutor. Thank you.
Ay, sorry. Okay. Look at this one, class. Poor communication, bullying, incompetent colleague, witnessing practice errors, and collegial collaboration. What level of concern is that? Okay, in moment of silence. Okay, baka lang hindi nyo lang mag-get yung question. Sige lang, class. Okay, so this one refers to your, let me see if it's here. Ay. Class, that one refers to your, okay, it refers to your team and unit level concerns. Okay, so if you might have noticed in the discussion, there are different levels, there are class of concerns. No? So you have the team and unit level concerns, and then you also have your system level factors. So if you would look at poor communication, bullying, incompetence, okay, and witnessing practice errors, that happens in the team or the unit. Okay, nangyayari po yan, class, sa team or sa unit kung saan tayo nagtatrabaho. Let's say, for example, you're working in the wards, you're working in the operating room, you're working in the emergency room, you will be able to witness. No? You will be able to witness these different types of concerns. Now, let's try to deal with them. Poor communications. Plus, anong pong payo natin sa pure communication? Sa poor communication, I mean. when I talk about your personal problems, is it okay to bring your personal problems to work? Is it
No,
okay to
No,
bring your
No,
personal
sir.
problems to
No,
work?
sir.
Okay?
No, sir.
No. Okay? No. Okay? Halimbawa, neighbors tayo. Okay? Halimbawa, Dana, we are neighbors. Tapos, ninakaw ko yung manok mo sa sobrang gutom ko. Kapag magkasabay tayo sa trabaho, Dana, okay, do not bring that personal concern. Okay? If we are handling our patients, let's just deal with our patients. Tapos pagdating sa bahay, doon na tayo magsinginan ng manok natin. Okay? Are you getting the point? So, now, it's easier said than done. Because the common concern that you will encounter in the hospital is, nag-away si Mr. at si Mrs. Tapos si Mrs. na nurse pagdating sa hospital, pagod. Okay? Or hindi kaya si Mr. na nurse pagdating sa hospital, nagrarant kasi ang stress sa bahay. There are things like that. And that is where your mental health would come in. Okay? So, you need to have recreational activities to balance your personal and work life. Now, bullying. Class bullying, it would still go back to zero tolerance. It would still go back to zero tolerance. Now, incompetent colleagues, pag may mga kasamahan ka later on na hindi alam yung trabaho, refer to your head nurse so that your head nurse would be able to formulate training programs for your incompetent colleagues. Okay? Or for example, ikaw later on you perceive na, 3 months na akong nagtatrabaho, parang hindi pa ako marunong mag-insert ng IV, hindi pa ako marunong mag-prepare ng medications, you can talk to your head nurse so that you can avoid incompetence. Okay? So that you can avoid incompetence. Next class, witnessing practice errors. Now guys, if you witness an error, okay? Let's say for example, nahuli mo yung kasamahan mo, he administered a different blood type to your patient. Okay? Halimbawa, instead of blood type A, yung nabigay niya sa pasyente mo, blood type O, which is intended for another patient. What will you do? Will you hide the error or mistake?
no, sir.
No, sir.
No,
sir.
sir.
No, sir.
Sige, I appreciate
Yes,
your
sir.
answer, no? I appreciate your answer. However, it's again, easier said than done. In the clinical setting class, alam nyo, halos mga nurses, pinatago yung mga pagkakamali nila. Okay? So class, wag tayong dapat ganon. Okay? Sir, how about if I will confess na nagkamali ako, I might lose my license. That's false. Okay? That's false. Although it is true that medication error, okay, grave errors in the hospital could lead to the losing of your license. But class, the mistake is more severe if you will not tell the truth. Bakit? If you will tell the truth, class, interventions could be done to reverse the effect of the medication or to prevent complications on the part of the patient. Halimbawa, nagkamali ng blood type na na-administer. Eh di kung naging honest, sana na-discontinue natin yung blood. Tapos sana naka-order ng laboratory test yung doktor to observe whether the patient is experiencing complications or not. In the same way, if you administered a wrong medication, okay, if you inform the doctor, supposedly the doctor will be able to give an antidote to reverse the effect of the drug. Okay? Rather than pinago mo siya, pagkatapos mong itago yung pagkakamali mo, the patient died, surely you will lose your license. Okay? Surely you will lose your license. So if ever class situations like that would happen, okay, just tell the truth, class, no? Yun yung sabi nila na the truth will set you free. This is a very good example, class, of the truth setting you free. Okay? And other than that, class, as I have mentioned, it allows for measures to be administered for your patients. Your system level factors natin is papasok yung senior administration and then institutional problems. Admittedly, no, not all bosses are perfect. Okay? Later on, you will be able to work with different kinds of managers. You will be able to work with different types of bosses. And you will come to realize, class, na wala tayong perfectong boss. Okay? Wala tayong perfectong boss. So that's one thing that we need to consider. Okay? Now, so briefly, let's talk about the human acts and acts of man. Okay? Or prior to that, let's define this term first. Okay, sorry, let's define this term first. Kindly read, it occurs when one knows the right thing to do but the constraints make it impossible or nearly impossible to pursue the right course of action. What do you call this?
Moral distress, sir.
Okay, this is your moral distress. Okay, or also known as yes, very good. Okay, that is your ethical dilemma or your moral dilemma for that matter. Okay, alam mo kung ano yung tama pero the situation does not allow you to do so. Okay, for example, in situations like a patient is on chest pain, you know that you would want to give oxygen. However, walang oxygen. Anong gagawin mo? So you are in an ethical dilemma. You are in moral distress or ethical dilemma for that matter. Okay, so kindly take note of that term. Now, I would want to go back to this one. Human act versus acts of man. So you have human act versus acts of man. Class, when I talk about voluntary act, is it a human act or act of man?
Human acts.
Voluntary. Okay, it's human acts. It's human acts. Now, class, if the act is based on judgment and choice, is it human act or act of man? Sige na. Based siya class sa judgment and choice, will it be human act or act of man?
Act of man,
Act
sir.
of man, sir.
Human act.
Human act, sir.
Okay. Okay, kayo nagdadalawang isip. Okay, so class, it's still human act. Now, what entails moral responsibility? What entails moral responsibility? Is it the human act or the act of man?
Human acts.
Act of man, sir.
Still your
Act of
human
man,
act.
sir.
Okay? It's still your human act. It's still your human act. How about class actions that are done consciously? Actions that are done consciously.
Acts of man, sir.
Acts of man, sir.
Acts of man.
Sige. Okay, so to avoid confusion on that class, okay, let's recap. Okay, plus it's very important for us to differentiate human acts and acts of man. Okay, bakit class? In ethics, we would want to deal with the human acts, but not with the acts of man. Okay, again, class, in ethics, our focus is the human acts and not the acts of man. Bakit? When I talk about your human acts class, your human acts are done with KFV. Okay? You have the acronym K, F, and V. So class, what does K, F, and V mean? Meaning class, when I talk about human acts, these are acts that were done with knowledge. These are acts that were done out of freedom. And these are acts that are done voluntarily. In other words, class, in Ilonggo, ginpilit siya bala nga obrahon na? Ginpilit siya or wala? Wala. Kinobra. Kaya ni class nga, iya lang mismo desisyon or may nagsugo sa iya?
Decision.
That's what you meant by human acts. And it is plus the human acts wherein we check whether it is morally correct or not. Because when you talk about human acts class, ginawa niya ito with full knowledge, with all the freedom and voluntary. In other words, class, nasa tamang pag-iisip ba ang taong gumagawa ng human acts?
Yes, sir.
Yes, because I've mentioned there's knowledge.
Yes, sir.
And for that reason, class, this person is considered to be morally responsible. Okay? Class, this person is considered to be morally responsible. Why is he morally responsible? Kasi he has the knowledge of doing it, he has the freedom to do it, he did it voluntarily. Example, if nagbebenta ka ng drugs, is it human acts or acts of man?
Human acts.
Human
acts.
Human act. Human act. Because you were told, halimbawa, bibigyan ka, uy, benta mo to. You are already at adult age, di ba? Tapos you are able to decide for yourself, okay? And then you have the freedom to do it. So it's considered to be a human act. But for example, somebody will point a gun to your head and will tell you, okay, you try to sell these drugs. Or no, not try. Sinasabihan ka, sell these drugs or else I will kill you. Will that be count as human act or act of man?
Act of man.
Acts of man.
In that case,
man.
class, if you will sell the drugs, that will be act of man. However, on the part of the person who is triggering you, that is human act. Okay? And he could be held morally liable because he is conscious of what he is doing. But if you are the one being forced, if you are the one being threatened to do it, okay, that would count as act of man. That would count as act of man. Okay? So again, class, pag sinabi kong with knowledge, with freedom, at saka voluntary, that's considered to be human acts. Okay? Whenever you have knowledge, freedom, and voluntary, it's considered to be human acts. Now, ano naman yung natural acts of man? Okay? Another way, class, for us to refer to acts of man is natural acts of man. No knowledge, no freedom, and then not voluntary. In other words, if your patient class has mental health problem, kumbaga unstable yung pag-iisip, tapos bigla na lang class sinuntok ka niya, is it human act or act of man?
Act of man.
Of man, sir.
That's already an act of man.
Of man.
That's already an act of man. And then, can I sue or can I file a case against that patient who punched me, who has a mental health problem?
No, sir.
Hindi. Because he
No.
does not have knowledge. Okay? He does not have the insight of what he's doing. Okay? So, yan class, yan yung isipin ninyo. Okay? So, that's why, yes, tama. He is mentally unstable. Kaya we cannot do legal action. That's why in ethics, we are more concerned of the acts that are done with knowledge, with freedom, and voluntary. Diyan yung concern natin pumapasok. Pero if it is act of man, yes, as nurses, we also deal with the acts of man, but we know that it needs other interventions, and it does not need an ethical decision for that matter. Okay? Now, let's just pick one example. Look at this. Is this act morally accountable? Ang tanong class, morally accountable. In other words, may pagkamali ba siya? A person who did something under hypnosis. Can I blame that person? Okay,
No,
so
sir.
class, there is no moral accountability there.
No,
Okay, there's no moral accountability there. Now, if you are watching mga crime scene movies or crime scene series, di ba, one thing that you can notice, if an act was done out of self-defense, you are not legally liable. Okay, again, I would like to repeat that. If an act was done out of self-defense, you are not legally liable. For example, if somebody was about to shoot a gun, okay, or about to pull the trigger of the gun, and then you suddenly punch him, tapos sa suntok mo, namatay siya, you will not be legally liable. Okay? As long as you can prove that indeed, nauna siya class na mag-pull ng trigger ng gun, supposedly. Okay? So if you acted out of self-defense, you are not morally accountable for that act because after all, you are just acting out of self-preservation. Okay? Is there any question that comes into your mind right now? Okay? Did you learn some insights for this afternoon?
Yes, sir.
Sir.
yes, sir.